What if I told you that thousands of adults in their 50s and 60s reduced chronic knee pain by more than 60% in just 8 weeks without injections, surgery, or expensive treatments? You don't believe me? These are real outcomes reported from multiple clinical trials in Japan and the United States where targeted muscle strengthening programs led to significant pain reduction and improved mobility in older adults with knee osteoarthritis. The real breakthrough is not that relief happened, but that it came from strengthening muscles around the knee instead of just treating the joint itself. And this matters deeply because according to the Arthritis Foundation, over 30 million adults in the United States experience knee osteoarthritis with risk rising sharply after age 50. The encouraging news is that research from Tokyo and Boston shows that specific strengthening exercises can restore knee stability, reduce inflammation, and rebuild confidence in movement. And that is exactly what we will show you today. Welcome back to another episode of the Senior Health Podcast, where East meets West to help you stay strong, steady, and independent. In a few minutes, we are uncovering the 5 exercises that directly strengthen the muscles supporting your knee and help you move with confidence. Once again, and as always, Japan's oldest doctor is guiding us. Doctor, how important is this episode? So important, John, because many adults over 50 are told knee pain is something they must accept as part of aging or manage with medication alone. But the 5 exercises I am about to share show how targeted muscle work can stabilize the knee joint and give people back years of comfortable movement. And the research supports this completely. Right. The level of improvement we see from these exercises often exceeds what medication can provide on its own. It really is remarkable, John. But before we begin, please share with us in the comments your age and where you are watching from since we'd low. Hello, and welcome. If you're here, chances are you've experienced the relentless, grinding reality of chronic knee pain. It's more than just a physical ache, it's a silent thief, stealing your joy, limiting your activities, and often dictating the very rhythm of your life. You might have been told to rest it, take it easy, or even that it's just part of getting older. You've probably tried various treatments, physical therapy, injections, painkillers, perhaps with temporary relief, only for the pain to inevitably creep back, leaving you frustrated and feeling utterly hopeless. I understand that feeling deeply. For years, the prevailing wisdom has pushed us towards caution, avoidance, and often, a sense of resignation. But what if I told you that much of what we've been taught about chronic knee pain is fundamentally incomplete, even misleading? What if the very advice intended to protect your knees has inadvertently contributed to their vulnerability, setting you up for a cycle of recurring discomfort and instability? This isn't just about pain management, it's about a revolutionary understanding that could fundamentally shift your approach and offer a genuine path forward, allowing you to reclaim the activities you love, without the constant fear of pain. It's time for a different conversation, one built on a deeper understanding of your body and its incredible capacity for healing and strength. We're about to uncover a shocking truth, but also a profound new hope. For too long, the focus on chronic knee pain has been almost exclusively on the joint itself, cartilage wear, meniscus tears, or inflammation. And while these are certainly factors, they often aren't the primary drivers of persistent pain, nor do they fully explain why some people with significant wear and tear live pain-free, while others with seemingly minor issues suffer immensely. The shocking revelation lies not just in what's wrong with the knee, but in what's not strong enough around it. Our modern lifestyles, characterized by prolonged sitting and reduced physical activity, have inadvertently deconditioned the very muscles designed to protect and stabilize our knees. Think about it: when you experience pain, your natural instinct, and often the advice given, is to avoid using the affected limb. While acute rest can be beneficial immediately after an injury, prolonged or excessive avoidance leads to muscle weakness and atrophy. This isn't just cosmetic. Weakened muscles, particularly the quadriceps, hip abductors, and glutes, cannot adequately support the knee joint, leaving it susceptible to excessive movement, strain, and ultimately, more pain. The irony is, by protecting our knees through inactivity, we're actually making them more vulnerable. This cycle is precisely why many conventional treatments fail to provide lasting relief, they address symptoms without tackling the root cause of muscular instability and weakness. It's a paradigm shift. Instead of fearing movement, we need to embrace targeted, intelligent strengthening. Let's delve a little deeper into the science behind this. When your knee experiences pain or injury, your body has a fascinating, albeit sometimes counterproductive, protective mechanism at play. It's called arthrogenic muscle inhibition, or AMI. Essentially, pain and swelling in a joint can switch off the surrounding muscles, preventing them from contracting effectively, even if they're not directly injured. Imagine trying to drive a car with the brakes slightly engaged. You're pushing the accelerator, but not getting full power. This is what AMI does to your quadriceps, especially the vastus medialis obliquus, VMO, a crucial muscle for kneecap tracking and stability. Even minor swelling or discomfort can significantly reduce its activation, leading to rapid muscle loss and further instability. This creates a vicious cycle. Pain leads to AMI, AMI leads to muscle weakness leads to more instability and pain, which then exacerbates AMI. This explains why even after an injury has healed, or inflammation has subsided, persistent weakness and pain can linger. It's not necessarily your knee joint itself causing all the trouble, but the compromised communication between your joint and the muscles meant to support it. Understanding AMI is crucial because it highlights why simply waiting for the pain to go away isn't enough. We must actively re-engage and strengthen these inhibited muscles. This might sound daunting, but it's actually incredibly empowering. The new hope for chronic knee pain doesn't lie in expensive surgeries, endless pain medication, or resigning yourself to a life of limitations. It lies within your own body's capacity to rebuild, strengthen, and stabilize. By understanding the role of muscular weakness and AMI, we can break the cycle. Our approach will focus on carefully selected, progressive exercises designed not just to build muscle mass, but to re-establish the brain-muscle connection that AMI disrupts. We'll start with foundational movements that gently reawaken those inhibited muscles, building a solid base of stability and control around the knee. This isn't about pushing through pain, it's about smart, intentional movement that respects your body's current state while guiding it towards greater resilience. Imagine regaining the confidence to walk further, climb stairs without apprehension, or even return to activities you thought were lost forever. This isn't a quick fix, but a sustainable path to long-term relief and a quality of life you deserve. We'll equip you with the knowledge and tools to become an active participant in your own healing journey, transforming vulnerability into strength, step by conscious step. In the upcoming chapters, we will embark on a detailed journey together. We'll demystify the true causes of knee pain, explore the science of stability, and most importantly, guide you through a practical, easy-to-follow exercise program. We'll start with fundamental movements like the quad set, designed specifically to combat AMI and re-engage your quadriceps, moving on to strengthen your hips, glutes, and ankles, all critical components of a healthy, stable knee. This program is for anyone tired of living with chronic knee pain, who is ready to take an active role in their recovery. You don't need fancy equipment, just a willingness to learn and commit. Get ready to rediscover what your body is truly capable of. It's time to move past fear, embrace strength, and unlock a future where chronic knee pain no longer defines your life. Let's begin this transformative journey, together, towards a more active, pain-free existence. Your new beginning starts right now, with us. Welcome back, friends. If you're joining us today, you're likely no stranger to the persistent ache or sharp twinge in your knees. It's a feeling that can steal your joy, limit your activities, and even dictate your daily life. For too long, the narrative around knee pain has been shrouded in confusion, often leading to frustration and a sense of helplessness. In this chapter, we're going to pull back the curtain and explore the real causes of knee pain, while also dismantling some of the most pervasive myths that might be holding you back from true healing. One of the most common myths is the idea that it's just old age. How many times have you heard or even said to yourself, "Well, I'm getting older, so my knees are bound to hurt"? While age can be a factor in some degenerative changes, it is absolutely not a direct sentence to a life of knee pain. Many people live vibrant, active lives well into their golden years without significant knee issues. The reality is, attributing all knee pain to age often stops us from looking for solvable, functional causes. Another prevalent misconception is that surgery is always the answer, or that significant structural damage, like a torn meniscus or bone-on-bone arthritis, automatically means severe, debilitating pain. While these conditions can certainly contribute, countless studies show that many people walk around with these exact same findings on an MRI, yet experience no pain at all. This highlights a crucial point: the severity of your pain doesn't always directly correlate with the severity of damage seen on a scan. So, if it's not always age or just structural damage, what are the real causes? Often, the root lies in something far more addressable: muscle weakness and imbalance. Think about your knee like a sophisticated pulley system. If the muscles surrounding it, your quadriceps, hamstrings, glutes, and even calf muscles, aren't working together optimally, or if some are significantly weaker than others, the joint itself bears an uneven load. This creates stress, instability, and eventually, pain. Our modern, often sedentary lifestyles contribute significantly to this. Sitting for prolonged periods can weaken the glutes and core, forcing the knees to compensate. Overuse without proper conditioning can also lead to imbalances. It's less about a sudden injury in many chronic cases, and more about a gradual breakdown in the body's natural support system around the knee. Beyond the physical mechanics, there's a profound, often overlooked player: your brain. Pain is not just a physical sensation, it's an output from your brain, a warning signal. When your brain perceives a threat to your body, it generates pain to make you stop or protect yourself. In chronic knee pain, this system can become hypersensitive. Even minor movements or loads might be interpreted as dangerous, leading to disproportionate pain signals. This phenomenon is often called central sensitization. Your brain, in its attempt to protect you, might be overfiring, keeping you in a constant state of perceived threat. This is why fear avoidance behaviors, avoiding movement because you anticipate pain, can actually worsen the problem over time, creating a vicious cycle of deconditioning and increased pain sensitivity. The good news is, understanding these real causes and misconceptions empowers us. It shifts the focus from a daunting, irreversible problem to a solvable, functional challenge. It means that you have a powerful role to play in your own recovery. By addressing muscle imbalances, strengthening the supportive structures around your knee, and retraining your brain's interpretation of pain, you can break free from the cycle. This isn't about quick fixes or ignoring underlying issues, it's about building a robust, resilient body that moves with confidence and without the constant burden of knee pain. We're here to guide you on that journey, step by empowering step. Many of us experience chronic knee pain, often feeling like a mystery that robs us of our mobility and joy. We might blame age, genetics, or past injuries. While these can play a role, a significant, often overlooked culprit is a lack of stability, particularly from the muscles surrounding our knee joint. Think of your knee as a sophisticated hinge, designed to move smoothly within a certain range. But for it to operate optimally, it needs a strong, supportive framework. Without this framework, the joint is vulnerable, leading to wear and tear, inflammation, and ultimately, persistent pain. This chapter will uncover the incredible science behind how your muscles can become your knee's best friend. At the forefront of this muscular support system are your quadriceps, the large group of muscles at the front of your thigh. These aren't just for powerful kicking, they are crucial stabilizers for your knee. When your quadriceps are strong and functioning correctly, they act like natural shock absorbers and guides, ensuring the kneecap tracks properly and the joint remains aligned. However, after injury or even prolonged pain, a phenomenon called arthrogenic muscle inhibition, AMI, can occur. AMI is your body's protective mechanism. When there's pain or swelling in a joint, the nervous system essentially shuts down or inhibits the surrounding muscles, preventing them from contracting fully. It's like a safety brake, but one that can unfortunately prolong weakness. Imagine trying to lift a heavy object, but your brain only lets you use 50% of your arm's strength because it thinks there's a risk. That's essentially what AMI does to your quadriceps. Even if the muscle itself isn't damaged, the signal from your brain to the muscle is impaired. This inhibition can lead to significant muscle atrophy and weakness, creating a vicious cycle. Weak quads lead to more knee instability, which can lead to more pain, which in turn exacerbates AMI. It's a silent, insidious force that prevents recovery, even when the initial injury might have healed. Many people struggle with knee pain for years because they're unknowingly fighting against AMI. The good news is that we can break this cycle. The key isn't just about strengthening in the traditional sense, but about reactivating these inhibited muscles. We need to tell your brain, it's safe to use these muscles again. This often requires very specific, gentle exercises that focus on muscle activation rather than just heavy lifting. The goal is to re-establish the neural pathways, improving the communication between your brain and your quadriceps. Think of it as rebooting a computer that's been stuck in a safe mode. These activation exercises are foundational, paving the way for more robust strengthening without irritating the knee. While the quadriceps are paramount, knee stability isn't a solo act. It's a symphony of surrounding muscles working in harmony. Your glutes, buttock muscles, hamstrings, back of the thigh, and even your core muscles all play vital supporting roles. Strong glutes help align your hips and knees, preventing inward collapse. Robust hamstrings complement the quads in dynamic stability. A stable core provides a strong base from which your leg muscles can operate effectively. Understanding this interconnectedness empowers us to approach knee pain holistically, ensuring all elements of your body's natural support system are working together towards lasting stability and freedom from pain. This comprehensive approach is your path forward. Welcome back. In our previous chapter, we delved into the fascinating science behind knee stability and how crucial those muscles around your knee truly are, especially after an event like arthrogenic muscle inhibition, or AMI. We talked about how your brain essentially forgets how to properly engage these muscles, leaving your knee feeling vulnerable and often painful. But here's the good news, we can reteach it. And the very first, most fundamental step on that journey is an incredibly simple yet profoundly powerful exercise called the quad set. Think of the quad set as pressing the reset button for your quadriceps, the large group of muscles on the front of your thigh. When you're dealing with knee pain, especially after injury or surgery, your body often defaults to compensating, using other muscles or moving in ways that further stress the joint. The quad set specifically targets and reactivates your quadriceps, particularly the VMO, vastus medialis oblique, which is often the first to check out after knee trauma. It's an isometric exercise, meaning your muscle contracts without the joint moving. This gentle activation helps re-establish that vital brain-to-muscle connection, improving circulation, reducing swelling, and laying the groundwork for stronger, more functional movements down the line. It truly is the cornerstone of knee rehabilitation, teaching your body to properly fire the right muscles without putting undue stress on your joint. So, how do we perform this magical reset button? Let's break it down, step by step. First, find a comfortable surface where you can lie down flat on your back, like a bed or a yoga mat on the floor. Extend both your legs out straight. Now, here's a crucial prop. Grab a small rolled-up towel or a soft cloth. Place this directly under the back of your affected knee. This tiny elevation is key, as it provides a target for your knee to press against. The goal is to gently but firmly push the back of your knee down into the towel. As you do this, you should feel the muscles on the front of your thigh, your quadriceps, tighten and contract. Imagine you're trying to flatten your knee completely against the surface. Hold that contraction. Remember to breathe naturally throughout the exercise. Don't hold your breath. Keep your foot relaxed, or gently pull your toes towards you if that feels comfortable, but the primary focus is the quad. Once you've achieved that good contraction, hold it for about 5 to 10 seconds. You might feel a slight tremor in your muscle, especially if it hasn't been working properly for a while. That's perfectly normal and a sign that the muscle is waking up. After the hold, slowly and gently release the contraction. Don't just let go suddenly, try to control the release, allowing your quad to relax deliberately. Take a short pause, maybe 2 to 3 seconds, and then repeat. For beginners, start with 10 repetitions, and aim to do this 2 to 3 times a day. As you get stronger and the muscle connection improves, you can gradually increase the hold time to 15 to 20 seconds and increase the number of repetitions. Listen to your body. If you feel any sharp pain, ease off. The goal here is activation, not exhaustion. A common mistake people make is using their hip flexors or tensing their entire leg. This exercise is specifically about isolating the quadriceps. If you're struggling to feel your quad contract, try placing your hand on your thigh to feel the muscle tighten. Another tip is to gently lift your heel off the ground by an inch or two as you press your knee down. This can sometimes help isolate the quad more effectively. Patience is your best friend here. This might feel incredibly subtle at first, almost like nothing is happening, especially if your muscle inhibition is significant. But trust the process. Every single mindful repetition is rebuilding that vital neural pathway, strengthening the foundation for a healthier, pain-free knee. This is more than just an exercise, it's a re-education for your body and mind, helping you regain control and confidence, one gentle squeeze at a time. Consistency is key, and every bit counts. Welcome back, friends. In our last session, we laid a crucial foundation with the quad set, awakening those sleepy quadriceps. Now, it's time to expand our focus, moving beyond just the front of your thigh to encompass the powerful muscles at your core, your glutes and hamstrings. Think of these as the unsung heroes in your body's intricate network, especially when it comes to supporting your knees. Many people grappling with knee pain often overlook the strength of their posterior chain, the muscles on the back of your body. When your glutes and hamstrings are weak, your quadriceps and knee joints end up bearing a disproportionate amount of stress. This imbalance can lead to improper movement mechanics and increased wear and tear on your knee cartilage. By strengthening these core muscles, we're not just building bigger muscles, we're creating a robust, stable base that acts like a natural shock absorber and a powerful protector for your knees. It's about distributing load more effectively and promoting healthier joint function. Our first exercise today is the glute bridge, a fantastic movement for activating and strengthening your glutes and lower back, crucial for pelvic stability and knee alignment. Lie on your back with your knees bent, feet flat on the floor, about hip-width apart, and your heels a few inches from your glutes. Ensure your arms are resting by your sides, palms down. Now, gently brace your core, imagine pulling your belly button towards your spine, and then, by squeezing your glutes, lift your hips off the floor until your body forms a straight line from your shoulders to your knees. Hold this peak contraction for a second or two, really feeling that squeeze in your backside. Slowly lower your hips back down to the starting position. Focus on controlled movements, not speed. Aim for 3 sets of 10 to 15 repetitions, taking a short break between sets. Remember, quality over quantity is key here. Next, we'll tackle heel slides, an excellent exercise for gently engaging your hamstrings and improving knee flexion and extension without putting excessive strain on the joint. Lie on your back, similar to the start of the glute bridge, but this time, keep one leg extended straight on the floor. With the other leg, slowly slide your heel towards your glutes, bending your knee as far as comfortably possible. Imagine dragging your heel along the floor, keeping it in contact the entire time. Once your knee is bent, slowly slide your heel back to the starting position, extending your leg. This controlled, smooth motion is what we're aiming for. You should feel a gentle stretch and contraction in your hamstrings. Repeat this movement for 10 to 15 repetitions on each leg, completing 3 sets. Pay close attention to how your body feels. If you experience any sharp pain, ease off or stop. These exercises are about gentle strengthening and regaining confidence in your movement, not pushing through discomfort. Incorporating these regularly into your routine will make a significant difference in how your knees feel and function daily. Think of it as adding more support beams to your house. The stronger the foundation and framework, the more resilient the structure. By consistently performing glute bridges and heel slides, you are actively building a stronger, more resilient body, directly addressing underlying weaknesses that contribute to knee pain. This isn't just about exercises, it's about empowering yourself to heal and reclaim an active, pain-free life. Keep up the amazing work. We're making real progress together. Welcome back, and congratulations on making it this far. We've journeyed through foundational exercises like the quad set, and built strength in your hips and hamstrings with glute bridges and heel slides. Now, it's time to extend our focus a little further down the kinetic chain, addressing two often overlooked yet incredibly vital areas for knee health: your ankles and overall functional movement. Think of your body as a magnificent, interconnected system. While our focus has been on the knee, the support it receives from above and below is paramount. Strong, stable ankles provide a crucial foundation, absorbing impact and influencing how forces travel up to your knees. Similarly, the ability to perform everyday movements with ease and control is the ultimate goal, translating directly into a life with less pain and more freedom. Let's begin with the simple yet powerful calf raise. You might wonder, why are we talking about calves when my knee hurts? It's a great question, and the answer lies in biomechanics. Your calf muscles, gastrocnemius and soleus, play a huge role in ankle stability, propulsion during walking, and shock absorption. Weak calves can lead to inefficient gait patterns, placing undue stress on your knees. Imagine walking on unstable ground. Your knees take a beating trying to compensate. Strong calves help stabilize that ground. To perform a calf raise, stand tall, holding onto a sturdy surface for balance if needed. Slowly lift your heels off the ground, rising onto the balls of your feet. Hold briefly at the top, feeling the contraction, then slowly lower your heels back down. Control is key here, avoid bouncing. Start with 10 to 15 repetitions for 2 to 3 sets, gradually increasing as you gain strength. You can perform these standing or seated, whichever feels more comfortable for your knees. Remember, we're building a resilient foundation from the ground up, literally. Next, we introduce an exercise that embodies functional strength, the chair stand, or sit-to-stand. This movement is incredibly powerful because it mimics one of the most fundamental actions we perform daily: getting up from a chair, a bed, or even a toilet. It engages your quadriceps, glutes, and core, all while improving balance and coordination, elements absolutely crucial for supporting your knees. For this exercise, choose a sturdy chair and sit comfortably with your feet flat on the floor, hip-width apart. Lean slightly forward, engage your core, and push through your heels to stand up, avoiding using your hands if possible. Once standing, slowly and with control, lower yourself back down to the chair, almost as if you're trying to sit on an egg without breaking it. The slower you go, especially on the way down, the more effective it is. The chair stand isn't just about getting stronger, it's about regaining confidence and independence. Many people with knee pain find the simple act of standing up challenging or painful. Mastering this exercise helps rebuild that lost confidence, transforming a once daunting task into an effortless movement. Start with a higher chair or use your hands for assistance if needed. As you get stronger, you can progress by using a lower chair, performing the movement without hands, or even holding a light weight. Aim for 8 to 12 repetitions for 2 to 3 sets. Listen to your body, and always prioritize form over speed or the number of repetitions. This is your journey, and every controlled movement brings you closer to your goal. These two exercises, calf raises and chair stands, are not just additions, they are integral components of a holistic approach to knee pain relief. By strengthening your calves, you're improving ankle stability and shock absorption, creating a more stable base for your knees. By mastering the chair stand, you're building functional power and confidence for everyday life, directly translating to less strain on your knee joints during common activities. Consistency, as always, is your greatest ally. Integrate these exercises into your routine alongside the quad sets, glute bridges, and heel slides. Remember, we are not just treating symptoms, we are rebuilding strength and resilience, one deliberate movement at a time. Empower yourself with every rep, knowing you are actively participating in your own recovery and forging a path towards a vibrant, pain-free life. Let's keep moving forward with purpose. The journey to knee health isn't always a straight line, it's more like a gentle winding path, full of discovery and self-awareness. After all the exercises we've discussed, from the foundational quad sets to the strength-building glute bridges and functional calf raises, the most crucial tool in your recovery toolkit isn't a specific movement, but rather your ability to truly listen to your own body. This chapter isn't just about what you do, but how you feel, and how you respond to those feelings. One of the biggest mistakes people make when embarking on a new exercise regimen, especially one aimed at recovery, is pushing through pain. It's a common misconception that, no pain, no gain, applies here. In the context of knee recovery, this couldn't be further from the truth. Mild discomfort or fatigue is normal and expected as your muscles adapt and strengthen. However, sharp, stabbing, or increasing pain during or after an exercise is your body's clear signal to stop and reassess. Think of your body as a wise old friend, offering gentle warnings when you're overdoing it. Ignoring these warnings can lead to setbacks, not progress. Always prioritize pain-free movement, even if it means modifying an exercise or reducing the intensity. Your long-term recovery depends on this mindful approach. Progress isn't always linear, and that's perfectly okay. There will be days when you feel stronger and more capable, and other days when your knees might feel a bit more sensitive. This fluctuation is a natural part of the healing process. Don't get discouraged by a bad day. Instead, view it as an opportunity to practice self-compassion and adjust your routine. Perhaps on those days, you focus on gentler stretches, more rest, or simply repeat an easier version of an exercise you've already mastered. Celebrating small victories, like being able to walk a bit further without discomfort, or feeling a slight improvement in your range of motion, is vital for maintaining motivation. Keep a simple journal to track your progress, noting not just the exercises you did, but also how you felt, both physically and emotionally. This tangible record can be incredibly empowering, showing you just how far you've come. Recovery is a holistic process, extending beyond just the exercises themselves. Sleep, nutrition, and stress management play equally critical roles. Adequate sleep is when your body repairs and rebuilds tissues. Aim for 7 to 9 hours of quality sleep each night. Fueling your body with anti-inflammatory foods, rich in fruits, vegetables, lean proteins, and healthy fats, provides the building blocks for healing. Think of your diet as an internal support system for your joints and muscles. And finally, stress. Chronic stress can exacerbate pain and inflammation, hindering recovery. Incorporate stress-reducing activities into your daily routine, whether it's gentle meditation, deep breathing exercises, spending time in nature, or enjoying a hobby. Creating a supportive environment for your body to heal involves caring for your mind and spirit too. Remember, this is your journey, and it's unique to you. While we provide general guidelines and exercises, the ultimate expert on your body is you. There's no one-size-fits-all timeline for recovery. Be patient with yourself, celebrate every small step forward, and most importantly, cultivate a deep, respectful relationship with your body. It's constantly communicating with you. Your job is to listen with an open heart and a discerning mind. Trust the process, trust your body, and know that every conscious effort you make brings you closer to a life of greater mobility, comfort, and joy. You're not just recovering, you're building a stronger, more resilient you. We've journeyed together through the intricacies of knee pain, peeling back layers of misconception to reveal the true culprits and the powerful solutions that lie within our own bodies. Remember that initial fear, the hesitation to move, the constant worry about every step? For so long, knee pain might have dictated your life, shrinking your world, and dimming your spirit. But through understanding the science of muscle stability and embracing the targeted exercises we've explored, you've begun to rewrite that narrative. This isn't just about physical recovery, it's about a profound shift in mindset, from helplessness to empowerment, truly a beacon of new hope. You've learned about the fundamental role of your quadriceps in stabilizing your knee, mastering the quad set not just as an exercise, but as a gateway to waking up dormant muscles. We then moved outwards, strengthening your hips and hamstrings with glute bridges and heel slides, key players in providing a solid foundation. These aren't just isolated movements, they're interconnected pieces of a magnificent puzzle, designed to restore balance and resilience. Each repetition, each focused contraction, has been a conversation with your body, rebuilding trust and demonstrating its incredible capacity for healing. It's about more than just stronger muscles, it's about a stronger, more confident you. From there, we focused on the crucial role of your ankles and overall functional movement, incorporating calf raises and chair stands to ensure your entire lower kinetic chain works in harmony. These exercises are about bringing everyday movements back into your life, but with renewed strength and stability. Think about navigating stairs, getting out of a car, or simply enjoying a walk. Activities that once seemed daunting are now becoming achievable again. This holistic approach ensures that you're not just treating a symptom, but building a robust system that can withstand the demands of daily living, allowing you to move with newfound ease and grace. But beyond the mechanics, this journey has been about listening to your body, understanding its signals, and celebrating every small victory. The courage to push gently, the wisdom to rest when needed, and the patience to embrace a gradual process, these are the hallmarks of true recovery. You've broken free from the cycle of fear and inactivity, replacing it with purposeful movement and a proactive stance towards your health. This isn't a quick fix, it's a sustainable lifestyle change, an investment in your well-being that yields dividends in energy, mobility, and an overall sense of liberation from chronic discomfort. Your resilience shines bright. As we draw this chapter to a close, remember that the goal isn't just to be pain-free, but to live fully. Reclaim those activities you loved, whether it's walking your dog further, playing with your grandchildren on the floor, dancing, or hiking a favorite trail. The foundation you've built empowers you to engage with the world without the constant shadow of knee pain. Embrace this newfound freedom, trust your body, and continue nurturing its strength. You have the knowledge and the tools to maintain this progress and live a life filled with movement, joy, and the unwavering confidence that you are in control. This is your life, restored. Welcome to our final chapter, a culmination of everything we've explored about reclaiming your knees and your life. We've journeyed through understanding the true causes of knee pain, debunking myths, and mastering the foundational exercises that stabilize and strengthen. Now, it's time to transform that knowledge into action. This isn't just about watching, it's about doing. Remember the profound sense of accomplishment we discussed? It begins with a single, deliberate step. Think of this as your personal blueprint for sustained well-being, a commitment to yourself. The power to change is truly within your hands, and it starts today, right now, with these next crucial steps. Take that leap of faith. The real magic happens through consistency. It's not about heroic, one-off efforts, but the steady drumbeat of daily dedication. Start small, perhaps just 10 to 15 minutes a day, focusing on the quad set, glute bridge, or heel slides. Listen intently to your body. It's your best guide. Some days you might feel stronger, others a bit more sensitive. That's perfectly normal. Adjust your intensity, but never abandon your commitment. Track your progress, even the smallest improvements. Celebrating these small victories keeps motivation high. Remember, progress isn't a straight line, it's a winding path with incredible rewards at its end. Patience and persistence are your greatest allies on this path. While this program offers a robust foundation, remember that personalized guidance can be invaluable. If you're experiencing persistent pain, severe discomfort, or have specific medical conditions, always consult with a healthcare professional. A doctor can rule out underlying issues, and a physical therapist can provide tailored exercises and techniques, ensuring your recovery journey is safe and optimized for your unique needs. Don't hesitate to seek expert advice, it's a sign of strength, not weakness, to understand when you need a little extra support. Your health is your most precious asset. To further empower your journey, we've curated a list of helpful resources. We recommend exploring reputable websites dedicated to physical therapy and exercise science, like the American Physical Therapy Association, APTA, or trusted sports medicine journals. Consider using a progress tracking app, which can help you log your exercises, monitor improvements, and stay accountable. We also encourage joining online support communities. Sharing experiences and tips with others who understand your journey can provide immense motivation and practical advice. Knowledge is power, and these resources are designed to put that power directly into your hands, enabling you to make informed decisions about your well-being. So, as we conclude this comprehensive guide, I want to leave you with a powerful message of hope and empowerment. Your journey to a pain-free, active life isn't over, it's just beginning. The tools, knowledge, and mindset you've gained are yours to keep and apply. Embrace the process, celebrate every victory, and remember that consistent, mindful effort will lead you to the freedom and confidence you deserve. Take action today. Don't wait for tomorrow. Your vibrant, active future awaits. As we close this chapter, remember that every challenge you've faced, every fear you've overcome, has forged the incredible strength within you. This isn't just about reaching a destination, it's about the remarkable person you've become on the journey. Embrace your journey, for it is uniquely yours, filled with lessons and triumphs that no one else can claim. Let your story inspire, knowing that your resilience is a beacon of hope for others. Stand tall, for the future is not just a destination, but a canvas waiting for the strokes of your unwavering spirit.